Hello friends and my dear students, my name is Mr. Rafiqul Islam. Today we'll be discussing about the second part of the prescription under the subject Pharmaceutics. So this topic will also be common for both Bachelor of Pharmacy first semester and Diploma of Pharmacy second year. So this is the continuation of the last lecture. So if you have not gone through the last lecture, please go through so that you can understand the continuity of the lecture. So first of all, the content of this lecture will be handling of prescription and modern method of prescription. Now let us look into handling of the prescription. So whenever a patient comes to the pharmacy with a prescription, the pharmacist should deal with the prescription as well as the patient in a proper way. First thing is receiving of the prescription from the patient. Secondly, reading and checking of the prescription in a proper way, collecting and weighing of the ingredients mentioned in the prescription. Finally, compounding, labeling and packaging. Now let us look into one by one in detail. Okay, the first one is receiving. So whenever the patient comes with the prescription, the pharmacist by themselves should receive the prescription. And the pharmacist should make sure that they do not change the facial expression. After receiving the prescription, even if there are different kind of medication listed that may be for deadly diseases, the pharmacist should not change the facial expression, because any change in facial expression can have a bad mental impact on the patient. Like a surprise or shocking kind of expression can have a bad impact on the patient. So we should make sure that we don't give any kind of expression after immediately reading the prescription. So secondly, reading and checking of the prescription. So when we receive the prescription, we should go through the prescription properly and make sure that the prescription is written in a proper format. Along with that, we should make sure that it has been signed by the prescriber along with the date. The screening of the prescription should be done behind the counter, so that in case of any confusion, the patient cannot identify that the pharmacist is confused. And if the pharmacist is confused, he should consult with the senior pharmacist present. If not, any experienced pharmacist that may be available in and around. If still the confusion persists, after that also, the pharmacist should immediately call the prescriber and get it clarified. The pharmacist should in no circumstances make any kind of assumption regarding the name of the medication. We know that the handwriting of the prescriber or the doctor generally is very difficult to be understood. Obviously nowadays certain improvement has been done in this sector. However, otherwise they generally write paracetamol, from which we can just identify P and L, right? So in such cases, if there are drugs like, for example, prednisolone and prednisone, in such cases a wrong assumption can be harmful for the patient. So in no cases the pharmacist should do any kind of assumption regarding the name of the medications. The third one is collecting and weighing of the ingredients. So whenever after going through the prescription properly, the pharmacist identifies all the ingredients, and after that the pharmacist collect the ingredients from the shelf and keep it on the left hand side of the weighing balance. After that it is transferred after weighing to the right hand side of the weighing balance, so which is then finally returned to the shelf. So in this process, the pharmacist should recheck or cross-check the name of the ingredients on the label at least 3 times. Firstly, while collecting from the shelf and keeping them on the left hand side. Secondly, while measuring them. Thirdly, while returning them back to the shelf from the right hand side of the weighing balance. The fourth one is compounding, labeling and packaging. So compounding should be done by the pharmacist in a very neat and tidy place. So so that there is no chances of contamination. Along with that, the pharmacist should make sure that he or she does the compounding of 1 prescription at a time. Even if there is a rush, we should avoid compounding 2 prescriptions at a time, so that there is no chances of error of mixing of any kind of ingredients or wrong ingredients. So after that, the compounding should be done strictly according to the prescriber's direction on the prescription. If there is doubt that some intentional or unintentional mistake has been done by the prescriber, then we should consult the same with the prescriber immediately. After that, the preparation that has been compounded should be transferred in a suitable container and should be labeled with all the necessary information that may be essential for the patient, like expiry date or the dose or direction of storage. All those necessary information should be mentioned on the label. The last one is the most crucial part, that is while delivering the package that we have prepared or compounded, it should be associated with all the necessary information that may be helpful or crucial for the patient. So we should give him the information regarding the mode of administration, regarding the dose, regarding the storage conditions. So all the necessary informations which may be helpful for the patient should be provided to the patient by the pharmacist in a very simple language without using any kind of technical terms, so that he does not make any kind of mistakes while consuming the medications and does not miss any kind of dose. So that was about handling of prescription. Now let us look into modern method of prescription. So in the olden days, what used to happen is that they used to prepare or compound the medications in the pharmacy itself, which used to be very problematic as well as time consuming. So the hygiene was one factor, and there used to be various errors like in weighing as well as in mixing as well. So nowadays the ready-made formulations are available in the pharmacy, which are prepared in the industry with due precautions of any kind of error. So this has become better, and the role of the pharmacists have changed drastically. Now the time that has been saved can be utilized in understanding the prescription as well as passing the proper appropriate information to the patient in a simple way, so that there is no chances of error. So in the modern method of prescription, the pharmacist has to hand over the medications after going through the prescription properly. In that process, the pharmacist should provide the information such as mode of administration of the drug, then dose schedule, drug interaction, and any adverse effects after consuming the medication. So all those information should be provided by the pharmacist to the patient, so that there is no problematic situation in the course of the administration of the medication. Now let us look into the various advantages of the modern method. So what are the advantages that we have switched into the modern method of prescribing? And we know that most of the formulations or the dosage form are available under various brand names, and the brand names are very catchy, so it becomes easier for the pharmacist to remember the names. Just take the example of omeprazole, which comes with a brand name Omes. It also becomes easier to communicate with the patient. Alongside, the most important thing is that any kind of error that can happen during handling of the weighing balance, or any other associated errors like while preparing or compounding the preparation that is to be dispensed to the patient. So all those errors, associated errors, are completely eliminated because of the modern method of prescribing. Alongside, hygiene and cleanliness can be maintained in a better way in the industry with all the sophisticated instruments, apparatus available in the industry, which however may not be possible in the older method of prescribing. Last but not the least, bioavailability can be enhanced by the modern method of formulation. So in industry, like the preparation can be done in such a way that various excipients may be added which can enhance the bioavailability, or in case if the drug that we are using is acid labile, we can do some coatings, or say take the example of enteric coated tablets. So the drug will be released only when it reaches the intestine. So the problem with the acid or the acid lability may be eliminated in such cases. So that becomes a very good advantage in the modern method of prescribing. Now let us have a look into a modern typical prescription. So in modern prescription, you can see in the screen that is Shaktiman Clinic. That is the name of the hospital or the clinic where the prescriber is sitting and diagnosing the patient and writing the prescription. And below that, that is the address, Borwa Complex, 6 Mile Junction. So that is the address of the clinic. So below that there is the contact number for emergency contact in case if the patient is having any kind of side effects or toxic effects or any kind of adverse effects, he or she can immediately contact the prescriber for emergency help. Just below that you can see the date, that is the date of the current day when the patient is consulting the doctor and the doctor is prescribing the medication. So that have its own significance that we have discussed in the previous lecture. Just below that there is the name, age, sex and address of the patient. So these are to identify the prescription to whom it belongs. Below that you can see a symbol RX, which is subscription, right? So just immediately after subscription comes the inscription, and under inscription the name of the dosage form that is to be dispensed to the patient along with the strength of the formulation is mentioned. So here it is tablet Parasip 500 mg. Immediately below that, it is dispense 10 tablets. So the pharmacist has been directed by the prescriber to dispense 10 tablets to the patient. That is called your subscription. So just immediately after subscription comes your signatura, that is given, mentioned by the short term SIG. So see, in signature, it has been written that one tablet to be taken twice a day after meal for 5 days. So that is the signature, that is the direction for the patient that will be given by the pharmacist to the patient regarding the mode of administration, and all other necessary associated information will come under signature. So this information should be properly given to the patient by the pharmacist in a simple language. Below that, you can see in the left corner, that is refill. So any kind of renewal instructions will be mentioned there. Right side to that comes the signature that should be done manually by the prescriber himself, along with the date and the name of the prescriber, the registration number, and the designation should be mentioned below that. So that is an example of a typical modern prescription. So I hope you can figure out the difference between the older method of prescription and the more newer method of prescription. So in the older method, if you remember, all the ingredients that were to be compounded and prepared a formulation, to prepare a formulation, all the ingredients that should be compounded and the way it should be compounded, everything was mentioned in the older method of prescription. But now in the newer method of prescription, only the dosage form, that is the ready-made formulation, is mentioned and it is directly dispensed. So compounding has been eliminated in the modern method of prescription. So my dear students, that was all about handling of prescription and the modern method of prescription. Okay, to summarize the entire lecture in short, we have discussed handling of prescription, we have discussed modern methods of prescription. So handling of prescription में क्या सीखा हमने? जब एक पेशेंट एक प्रेस्क्रिप्शन लेके फार्मासिस्ट के पास आता है, फर्स्ट थिंग इज रिसीविंग. सो कैसे रिसीव करना है? फार्मासिस्ट को खुद से रिसीव करना है. उसके बाद पढ़ने के बाद, द लिस्ट ऑफ मेडिकेशन पढ़ने के बाद, उस फार्मासिस्ट को कोई फेशियल एक्सप्रेशन नहीं देना है. लाइक जैसा नॉर्मली है वैसे ही रहना चाहिए, ना कि कंफ्यूज एक्सप्रेशन, ना कि कुछ सरप्राइज एक्सप्रेशन देना है जिससे कि खराब इम्पैक्ट पड़ सकता है पेशेंट के मेंटल स्टेटस पे. So after that, reading and checking of the prescription. So after receiving, एक फार्मासिस्ट को उस प्रेस्क्रिप्शन को अच्छे से पढ़ना चाहिए, और पढ़ने के बाद ही शुड चेक दैट एक स्टैंडर्ड फॉर्मेट के तहत लिखा गया है कि नहीं. उसके बाद उसमें सिग्नेचर है कि नहीं प्रेस्क्राइबर का, अलॉन्ग विद द डेट शुड बी द प्रेजेंट डेट, ना कि कोई पुराना डेट. आफ्टर दैट ये मेक श्योर करना है कि जो इंग्रेडिएंट्स लिखा है उसको समझ में आ रहा है कि नहीं. अगर समझ में नहीं आ रहा है, जो सीनियर फार्मासिस्ट है उससे बात करना चाहिए, या फिर कोई एक्सपीरियंस फार्मासिस्ट है तो उससे बात करना चाहिए. फिर भी अगर समझ में नहीं आ रहा है, कभी भी उस चीज़ को एज्यूम नहीं करना है. जस्ट फॉर एग्जाम्पल, अगर प्रेडनिसोन लिखा है तो गलती से प्रेडनिसोलोन नहीं पढ़ लेना चाहिए. अगर समझ में नहीं आ रहा है किसी भी सिचुएशन में, देन उसको प्रेस्क्राइबर या फिर डॉक्टर जिसने प्रेस्क्राइब किया है उसके साथ बात करके उस चीज़ को क्लैरिफाई कर लेना चाहिए. सो आफ्टर दैट वी हैव डिस्कस अबाउट कलेक्टिंग एंड वेइंग ऑफ द इंग्रेडिएंट्स. सो कैसे इंग्रेडिएंट्स को कलेक्ट करना है. सो सब चीज़ों को कलेक्ट करके फ्रॉम द शेल्फ, लेफ्ट साइड ऑफ द वेइंग बैलेंस, लेफ्ट साइड ऑफ द वेइंग बैलेंस पे रखना है. उसके बाद वेइंग करने के बाद उसको राइट साइड में रखना है, एंड उसके बाद फिर उसको शेल्फ पे रिटर्न करना है. इन दिस प्रोसेस हमें 3 बार नेम ऑफ द इंग्रेडिएंट्स ऑन द लेवल 3 बार हमें क्रॉस चेक करना चाहिए. पहली बार जब हम लोग मेडिसिन को शेल्फ से उतार के वेइंग बैलेंस के लेफ्ट साइड में रख रहे हैं उस समय, उसके बाद जब हम लोग मेजर कर रहे हैं तब, और लास्टली जब हम लोग वेइंग करने के बाद राइट साइड में रखते हैं, उसके बाद उसको रिटर्न करते हैं शेल्फ पे रिटर्न करते समय. व्हाई? बिकॉज चेक करने से एरर का चांसेस कम होगा, ताकि हम लोग गलत इंग्रेडिएंट्स ना ले रहे. सो 3 टाइम चेकिंग विल पॉसिबली रिमूव एनी काइंड ऑफ एरर्स. लास्ट में कंपाउंडिंग, लेबलिंग एंड पैकेजिंग. सो एज अ फार्मासिस्ट, कंपाउंडिंग हमें हमेशा साफ सुथरी जगह पे करना है, नीट एंड टाइडी प्लेस पे, एंड एक टाइम पे एक ही प्रेस्क्रिप्शन को कंपाउंड करना है, ना कि पैसों की लालच की वजह से जब 2-3 पेशेंट एक ही साथ आ गया हो तो हमें 2-3 प्रेस्क्रिप्शन एक ही साथ हाथ में लेके एक साथ कंपाउंड नहीं करना है, क्योंकि उसके जरिए चांसेस ऑफ एरर बढ़ जाता है. एक प्रेस्क्रिप्शन का इंग्रेडिएंट्स दूसरे प्रेस्क्रिप्शन में मिक्स होने का चांसेस रहता है, उससे पेशेंट के हेल्थ पे बैड इंपैक्ट पड़ सकता है, या फिर इट कैन बी लीथल इन सम केसेस. सो उस वजह से हमें वो सब चीज़ें अवॉइड करना है. सो एक ही प्रेस्क्रिप्शन को कंपाउंड करेंगे एक ही टाइम पे, एंड जो प्रिपरेशन करेंगे, द कंपाउंडिंग दैट वी विल डू, इट शुड बी स्ट्रिक्टली अकॉर्डिंग टू द प्रेस्क्राइबर. जैसे डॉक्टर ने उस चीज प्रेस्क्रिप्शन पे लिखा हुआ है, उसी के तहत हम लोग मिक्सिंग या फिर प्रिपरेशन ऑफ द इंग्रेडिएंट्स, प्रिपरेशन ऑफ द फॉर्मुलेशन विल बी डन इन दैट प्रोसेस ओनली. आफ्टर प्रिपरेशन, उस प्रिपरेशन को बनाने के बाद हम लोग एक स्वीटेबल कंटेनर में ट्रांसफ़र करेंगे, एंड ट्रांसफ़र करने के बाद उसको प्रॉपर्ली लेबल करेंगे. लेबलिंग में ऑल द नेसेसरी इन्फॉर्मेशन जो एक पेशेंट को दरकार हो सकता है वो सारी चीज़ें उसमें मेंशन करेंगे. एंड लास्टली जब हम लोग उस प्रिपरेशन को पेशेंट को हैंड ओवर करेंगे, उसके साथ हमें सारे ज़रूरत इन्फॉर्मेशन लाइक ऑल द नेसेसरी इन्फॉर्मेशन दैट मे बी इसेंशियल, जैसे कि कैसे लेना है उस चीज़ को, वेदर इट विल बी ऑरली या फिर पानी में घुल के मिक्स करके डिजॉल्व करके लेना है, या फिर वार्म वाटर के साथ लेना है, या कोल्ड वाटर के साथ खाने के बाद लेना है, खाने से पहले लेना है, जैसे भी लेना है उस चीज़ का इन्फॉर्मेशन हम लोग को एज अ फार्मासिस्ट इट इज़ आवर सोल रिस्पॉन्सिबिलिटी कि हम उस चीज़ का प्रॉपर इन्फॉर्मेशन इन अ सिंपल लैंग्वेज, एक सरल भाषा में, ताकि एक पेशेंट और एक जनरल पर्सन हु इज नॉट हु हैव नॉट इवन स्टडीड आल्सो समझ पाए उस चीज़ को। सो उस चीज़ को उस इन्फॉर्मेशन को हम लोग एक पेशेंट को प्रॉपरली प्रोवाइड करेंगे। सो दैट बिकम्स द वाइटल रोल ऑफ द फार्मासिस्ट। सो आफ्टर दैट वी हैव डिस्कस अबाउट द मॉडर्न मेथड ऑफ प्रेस्क्रिप्शन। सो एक ओल्डर मेथड था, एक मॉडर्न मेथड है। ओल्डर मेथड में क्या होता था, ये कंपाउंडिंग होता था, जो हमने अभी डिस्कस किया, कंपाउंडिंग ऑफ द वेरियस इंग्रेडिएंट्स। सो मॉडर्न मेथड में क्या होता है, रेडीमेड फॉर्मुलेशन अवेलेबल रहता है फार्मेसी में, सो उस चीज़ को दे दिया जाता है। उसके वजह से बहुत सारे एडवांटेजेस आ गया है। सो एडवांटेजेस क्या है मॉडर्न मेथड का? एडवांटेजेस ये है कि एक तो टाइम बच जाता है फार्मासिस्ट का। दूसरा चीज़ ये है कि ब्रांड नेम्स रहने की वजह से नाम याद करना आसान रहता है। अलॉन्ग विद दैट पेशेंट को इन्फॉर्मेशन देना ईजी हो गया है, क्योंकि उसको कंपाउंडिंग के बारे में इतना कुछ समझाने की जरूरत नहीं, बस कैसे लेना है, मोड ऑफ एडमिनिस्ट्रेशन कैसे रखना है उस फॉर्मुलेशन को घर पे, वेदर इट शुड बी केप्ट अवे फ्रॉम द लाइट, वेदर इट शुड बी स्टोर इन अ कूल प्लेस, ऑल दोस इन्फॉर्मेशन आसानी से एक पेशेंट को समझाया जा सकता है। उसके अलावा अगर किसी फॉर्मुलेशन, किसी ड्रग का बायोअवेलेबिलिटी कम है बाय वेरियस प्रिपरेशंस लाइक टैबलेट्स और कैप्सूल्स, उस चीज़ को उसका बायोअवेलेबिलिटी या फिर एनी काइंड ऑफ नैनो फॉर्मुलेशन, उसका बायोअवेलेबिलिटी बढ़ाया जा सकता है इन द इंडस्ट्री। द मोस्ट इंपॉर्टेंट थिंग, हाइजीन एंड क्लीनलीनेस कैन बी अच्छे से मेंटेन किया जा सकता है इन द इंडस्ट्री विद ऑल द सोफिस्टिकेटेड इंस्ट्रूमेंट्स और एपरेटस अवेलेबल, विद द टेक्नोलॉजी अवेलेबल इन द इंडस्ट्री, विच हाउएवर एक फार्मेसी में पॉसिबल नहीं हो सकता है। So that becomes a very crucial role that becomes a very big advantage or major advantage of the modern method of prescription. So that was all about the handling of the prescription and the modern method of prescription. If you have any kind of doubt regarding this, you can put down your queries in the comment section, or you can reach me out at the email given below. So I have framed out some multiple choice question based on the lecture 1 and lecture 2. I hope you'll be able to solve after the completion of this video lecture. So see you soon in the next lecture. Thank you. So I have framed out some multiple choice question based on the lecture 1 and lecture 2. I hope you'll be able to solve after the completion of this video lecture. So see you soon in the next lecture. Thank you.